Hello everyone, this is Dr. Rasti speaking. If you are planning to board a flight to Turkey, Thailand, Colombia, or wherever to get plastic surgery or advanced aesthetic treatments, I need you to pause for the next 5 minutes. Many people think that global aesthetic tourism, global health tourism is a simple deal. You see some ads on Instagram or TikTok and you board a plane, you buy the tickets, you coordinate with the clinic in the destination country. You go there, you get the best aesthetic procedures or best plastic surgeries done for a fraction of the Western costs, and you come back safe and sound. But that is not the reality. As a practicing aesthetic doctor and researcher in regenerative medicine, I know what goes on behind the curtains, and I'm going to reveal some of the secrets to you and help you coordinate global medical arbitrage safely. Our problem is the illusion of the top clinic. While in reality, when you search for plastic surgery in Thailand or hair transplants in Turkey, the results you get and what you see is the result of search engine optimization. And nowadays, almost all of the global medical tourism industry is run by advertising agencies and commercial clinics and travel agencies that are incentivized to maximize volume by sending patients in the way of those commercial clinics. Now, clinics utilize this environment easily by having lifestyle influencers, paying advertising agencies exorbitant amounts because it pays off for them. But while this is a great way for marketing and finding clients and patients, it is not the safest and best way for patients. What patients need is not just cost-effective procedures. They need the highest medical qualifications and the highest quality of procedures that they can receive wherever they're headed to, regardless of how much they're willing to spend. Now, there are specific tricks that these commercial clinics pull that patients are completely unaware of. One of them is that they have a few high-level, top-level known surgeons that perform some of their plastic surgeries, and then they have many technicians and other junior doctors who are not as experienced or might not even be specialized for that specific surgery. And they hand off a lot of the surgeries, especially in high volume clinics, to those junior doctors or even technicians. Some countries regulate, but they're not enforced that highly, especially for transplant surgeries, hair transplant, specifically in those countries that are prominent for them. So when deciding where to go, you need to analyze everything, and you need to take into consideration the dangers that you might face by heading out of the country and going to another country for aesthetic procedures or plastic surgery. You must be prepared, and you must have the qualified person to guide you through this, not just the clinic's own translators or the clinic's own advertising agencies or paid influencers. What's the solution, you might ask? Well, true geographic arbitrage and getting the highest level medical procedures, be it plastic surgery or aesthetic procedures or regenerative procedures done internationally, is completely possible. And getting them for the best prices, best international prices, is also possible. But you need to have a completely different approach towards it. You do not need travel agencies or influencers telling you how to do this. What you need is an independent medical auditor. As a medical insider, I look for the specific requirements that every high-intent international patient requires. Be it that's a patient's profile and the specific anatomy that each patient has, which must match with the surgery style of the surgeon. And when I look at a surgeon or a clinic, I do not analyze the luxury of their lobby or their follower counts. What I do is that I analyze the surgeon himself, his complication rates for that specific procedure for the past 24 months, what their specific plans are for postoperative care, and what their contingencies are if something goes wrong for a patient abroad in another country. Global health tourism is wonderful, and it's an asset for high-intent patients, but it must be done right and safely. I have spent years building aesthetic clinics and doing global research in the global aesthetic procedure scene and the industry itself. And what I suggest to you is that do not leave your health to some marketing algorithms and value your safety. I do not work for any commercial medical board, and I'm not in contract with any clinics in any country or any specific advertising agency for bringing in patients on commission. I work entirely and privately for you. And if you value your safety more than anything else, just like any reasonable person, and you are an high intent patient and you intend to have high level aesthetic procedures or plastic surgery done, head to the link down below and fill out the private medical concierge form. I personally review every form and we contact every patient that's a good fit for our private medical vetting procedures. Thank you for listening to me. And if you found value in this video, please like and subscribe. And ask me your questions in the comments. I will do my best to answer as quickly as possible.